We are continuing our effort tonight to fight fear with facts as the coronavirus pandemic continues to impact communities across the globe. Infectious disease expert Dr. Ruth Berggren from UT Health San Antonio, the Long School of Medicine, is back with us this week to help us get answers to our coronavirus questions. Dr. Berggren, thank you very much for joining us. Let's start. What is immunity testing, and is it coming to San Antonio? It's our first viewer question tonight.
Sure. So, Steve, immunity is what happens when your body is battling a foreign invader, right? And basically, if you might remember from high school biology, you've got white blood cells that fight off foreign invaders and also antibodies, which are proteins. And you can kind of think of it as a cowboy trying to lasso a steer. The rope of the lasso is kind of like an antibody, and the steer is, well, the horns of the steer, like the pokey things on the outside of that coronavirus. And so when you get enough antibodies on that coronavirus, you can literally neutralize it. And that's what we're looking for with immunity, is making enough antibodies to neutralize the virus. Now, after that battle has happened and the virus is long gone, well, guess what? The antibodies stick around in the blood, and you can measure them. And we now have a test for that. And the test has been approved by the FDA, and we're getting it here in San Antonio. We expect it in the next week or two. It's going to be very helpful for us, Steve, because we'll be able to figure out how many people have actually been infected already and gotten over the disease. And that will give us a better sense of where we are at in our community with fighting off this virus.
So when we get this immunity testing, it's a very good thing.
Yes, we won't know exactly what it means right off the bat, because what we hope is that when we find the antibodies, that means a person had the disease, they recovered, and they're immune. We don't know for sure until the test has been around and we've tried this out whether these people are truly immune or not. And of course, we want to take special precautions to prevent people from getting sick, so we're going to be very careful about easing the restrictions. But this is progress in the fight against this virus. We need this test. We are going to learn from it, and it's going to help us, I believe, figure out how we can reintegrate ourselves into a more normal existence.
Right, which is the next step in this whole thing. Talk about one of the questions we have tonight is from South Korea. Reported that at least 116 people initially cleared of the new coronavirus have tested positive again. What do you make of that, and what should we be listening for and reading for when we hear these kinds of reports?
Yeah, it shouldn't be too surprising, because we had heard about this already from China. People who had been cleared of the virus, then they tested them much later just to be absolutely certain. And then they found, when they put a swab up into their nose and then tested that swab with a reaction called PCR, they found fragments of virus. We have no idea if that virus that's found much later after the person has recovered, we don't know if that virus is alive or dead. And those could just be fragments of dead virions that are lying around. We have no evidence to date that such people can transmit the virus to others, but we learn something new every day with this virus, Steve. And so we need to watch, we need to study, and we need to learn. I think one of the lessons, one of the takeaways from this report is that we shouldn't be too much in a hurry to relax our social distancing rules, which we know are saving lives.
Next question, I think, also has to do with some of the blood studies that are being done in town. Do San Antonio medical and research facilities studying and using blood plasma of previously infected patients to treat new patients have any preliminary results yet?
Yes, so we're looking forward to having those results, but they really haven't been published. And we do hope that aggregate data from around the country where people are using convalescent plasma to treat patients who have active disease, we're looking for those data, and hopefully we'll see a publication soon, but there's nothing out just yet that can tell us whether that works. We hope, though, that folks who are recovering from the virus will think about the fact that their blood might be very helpful to someone else and might be able to help save a life.
Absolutely. All right, next viewer question. Does COVID-19 stay active in a deceased person? And if so, how long?
Yes, so clearly after a person dies, there's still going to be virus in that person's body, and it still could infect somebody, but it's not going to jump out of the person's body and onto someone else. In order for a person to get infected from the body of a deceased person, they would have to touch that body and then rub their own face or their eyes and get infected in that way. And they're very careful and well-written guidelines from both the CDC and the World Health Organization, providing advice for coroners and actually family member of deceased people about how to handle those bodies. And essentially, it's the same precautions that you would take around a person who is living. The deceased cannot cough, and so the mask is less of an issue, but you want to be careful about touching the body, and you want to be careful about washing hands and taking precautions of that nature.
All right, next question. Are hives/skin eruptions an emerging sign of COVID-19?
Boy, that's another example of how you learn something every single day with this pandemic. There are reports, and from credible places, including from the Mayo Clinic, including from dermatologists. And there's some small studies. I believe there was a study out of Italy where maybe about 20% of a group of 88 people that were studied had some kind of skin finding, red rash, usually on the trunk. It can look like hives. It might be blistering. But this seems to really be in the minority, and that finding was not reported in much of the data that came out of China. So this is something to be watched for and to be studied. What is the takeaway? I guess if you're somebody who doesn't normally get hives, and you have some new and unusual skin eruption, maybe in combination with feeling poorly, maybe you feel achy or a little fever, that could be a reason to trigger you to go online to that sanantonio.gov website and take the online survey and determine if you really should get tested for coronavirus.
Yeah, better safe than sorry. All right, if you recover from COVID-19, are there any long-term issues that stay with you?
So again, data to be determined. We need to study this disease and monitor what's happening. For sure, folks that have been in the intensive care unit, people who needed to be intubated and had terrible problems with their breathing and their lungs, it's going to be a while before those lungs recover to their normal healthy state. So at a minimum, someone who's had a long and rocky intensive care unit course will have recovery issues, both with respect to their breathing, also with respect to the deconditioning of their body after they've been lying in a bed in a coma for up to 2 weeks. And finally, this virus affects the heart, Steve, and we have more to learn about whether there will be any lasting effects on the health of the heart muscle after someone has recovered. But clearly, many people have recovered from mild disease and are walking around and doing just fine. So we need to keep a perspective on this. It's the minority of people that are going to get into serious trouble, and the minority of those that would have long-lasting effects from the virus.
Yeah, it's interesting you bring up the heart. I usually think of it as affecting the lungs perhaps more than anything else, and that could also be a long-term thing, correct?
Right. It clearly affects the lungs as well as the heart. The kidneys have been infected, and this is all because there's an overwhelming inflammatory response when the immune system gets activated in certain people. So every organ system can be damaged by that kind of overwhelming inflammatory response that gets triggered in some folks.
All right, every Tuesday, I love to give you the final word in what we're going to talk about, and I'm just going to lob this one up to you, Dr. Berggren. Any good news to share tonight?
Yeah, I think the good news is that San Antonio took the message seriously. San Antonio has continued to take the message seriously. We have clearly flattened our curve, and now we need to show our endurance and our stamina. And don't give up. You're saving lives every day by staying home. Progress is being made with treatment. We have remdesivir, that's an antiviral that's being studied. We have convalescent plasma. We have new tests that are on the way and better tests. We're learning how to diagnose the disease faster so we can isolate people more quickly. We're going to learn about how many people have already been infected and gotten over the disease. That's going to help us figure out how we get people back to their normal lives. We're inventing new things. Like a new mask that's even better than the N95 mask, something that was invented right here in San Antonio in our own university hospital. So all of these are bright spots on our horizon. We need to hang on to those bright spots. We need to hang on to the light, in what is otherwise a very difficult and challenging time in our country and our world.
Love that message. Dr. Ruth Berggren from the Long School of Medicine at UT Health San Antonio. Thank you for joining us.
Happy to be here.
We'll be right back.